So for the bony landmarks of the humerus and the ulna, or just the arm in general, we're going to start with the humerus. So that's going to be your arm bone that runs all the way from your shoulder down to your elbow joint here, and it joins with the radius and the ulna. So we're going to have the medial epicondyle, which is a part of the humerus. So you'll find this by straightening the arm in supination, in anatomical form. And then you are going to go on either side of the elbow. You're going to have two bony landmarks. So the medial epicondyle is going to be on the medial side. It's very prominent. You can feel it. So it's going to be right here. And then on the lateral side, it's a little bit less prominent, but you can feel it. And they're inline, so they should be very easy to find. And then right in between the two, or if you just bend your elbow, this very prominent bony landmark right here is going to be the olecranon process. And then if you're in kind of a 90-degree angle and you track this olecranon process a little bit more proximal, you'll feel a little bit of a notch, and that's going to be the olecranon fossa. So that's going to be where the olecranon process actually latches into that when you extend your arm or go into extension with the elbow joint. And then you'll have the trochlea as well. So the trochlea is going to be a part of the humerus, and it's kind of hard to palpate because it's pretty deep. But that's going to be the part of the humerus that actually inserts with the trochlear notch, which is going to be on the ulna. So that's going to be right in here. So the trochlear notch is going to be on the ulna. It's going to be kind of sitting like this, like a cup. And then the the trochlea on the humerus is going to be kind of like this. So it's gonna fit into it like this. And then we'll have the radial head, and to palpate that, you want to find the lateral epicondyle on the humerus, and then you are going to want to go a little bit distally from there, so about a thumb's width, and then you'll feel a little bit of a gap, and then right there, just distally, you'll find another bony process, and that's going to be the head of the humerus. Okay, and now I will be palpating all the different muscles. So the first muscle we're going to have is the biceps brachii. So it's going to be this big one right here in the arm. So it's going to come all the way up from that shoulder down all the way to that elbow. And this one is going to be, it causes supination as well as flexion. So supination as well as flexion at that elbow joint. And then we're going to have the brachialis, which is actually going to sit under that biceps brachii. So it's kind of hard to palpate, but it's going to start about halfway down that humerus, halfway between that shoulder joint and that elbow joint. And then it's going to run all the way down to this elbow joint. And you can kind of see part of it when you flex the bicep. It reveals part right here. And then that one is going to be used just for elbow flexion. And then we have the brachioradialis. So that one is actually going to be, it's going to run across the elbow joint. So it's going to start in this forearm right here. It's going to be this big part. And then it's going to run across the elbow joint right into here, right into that bicep. So this one is actually going to do pronation, and then it also does flexion at that elbow as well. And this one is the most effective when you're kind of in that neutral position, so not supinated or pronated, but just kind of that neutral position. And then flexion, that's when it's most effective. And then we have the triceps brachii, so I'll have you turn around for this one. Alright, so for the triceps, there's going to be 3 different heads. So you're going to have the long head, the medial head, and then the lateral head. And they're all just going to run down here. The medial head and the lateral head are going to be a little bit shorter than the long head, obviously given the name. but they're all gonna run right down here to that elbow from that shoulder joint. And then we will have the aconius, which is going to start at that lateral epicondyle and then run kind of across here. So right along there. It's going to be kind of a shorter one, so you can feel it right here. And then that one is going to be involved in elbow extension, so like that. And then we have the pronator teres. I'll have you turn back around for that one. So the pronator teres is going to also start at that lateral epicondyle, at the medial epicondyle, and then it's going to kind of run right across here. So this one's a little bit harder to feel, but you can kind of feel it's going to run right in here, right along here. And that one is going to be just used for forearm pronation, so like that. And then we also have the supinator. So the supinator is going to start at that lateral epicondyle, and it's going to run across the forearm. So it's going to be right along here if we palpate it. So right along here. And that one is going to be used for supination. And then we have the pronator quadratus, and that one is going to be down here. So it's going to be run kind of from the medial, from the lateral to the medial side. So the radial side to the ulnar side, just across that would be the anterior part of that forearm. So just right across the wrist here, and it's hard to palpate because there's a lot of tendons in the way, but it's just gonna be kind of a horizontal fiber that runs right across the wrist right there.